Welcome. In this video, we'll be exploring aortic stenosis, a serious heart condition affecting many individuals worldwide. We'll delve into the causes, symptoms, diagnosis, treatment, and more, providing you with a comprehensive understanding of this ailment. Aortic stenosis, at its core, is a narrowing of the aortic valve opening. This valve sits between the left ventricle, the heart's main pumping chamber, and the aorta, the body's largest artery. The narrowing restricts blood flow from the heart into the aorta and the rest of the body. The primary causes of aortic stenosis vary with age. In older adults, it's often due to calcification, a gradual build-up of calcium deposits on the valve leaflets, essentially hardening and stiffening the valve over time. In younger individuals, congenital heart defects, particularly a bicuspid aortic valve, meaning the valve has 2 leaflets instead of the normal 3, are often responsible. Rheumatic fever, a complication of untreated strep throat, was once a significant cause, damaging the valve and leading to scarring and subsequent stenosis, though this is less common now in developed countries. Now let's consider the consequences of this narrowing. As the aortic valve becomes stenotic, the left ventricle has to work harder to pump blood through the constricted opening. This increased workload leads to left ventricular hypertrophy, or thickening of the heart muscle. Initially, the heart compensates effectively, maintaining normal cardiac output. However, over time, the thickened heart muscle becomes stiff and less efficient. This can lead to decreased cardiac output, reduced blood flow to the body, and increased pressure within the left atrium and pulmonary circulation. The increased pressure in the pulmonary circulation can result in pulmonary congestion and shortness of breath. Furthermore, the reduced blood flow to the coronary arteries can cause chest pain, also known as angina. Eventually, the heart can no longer compensate, leading to heart failure. Aortic stenosis is a fairly common heart valve disease, particularly among older adults. Prevalence increases significantly with age. Studies estimate that approximately 7% of individuals over the age of 65 have some degree of aortic stenosis, and the prevalence rises to over 10% in those over 80. The incidence of aortic stenosis is expected to increase as the population ages. The underlying causes can influence the demographics. For example, bicuspid aortic valve is present in about 1–2% of the population. The signs and symptoms of aortic stenosis can vary depending on the severity of the narrowing. Many people with mild to moderate stenosis may not experience any symptoms for years. However, as the stenosis worsens, symptoms typically develop. The classic triad of symptoms includes chest pain or angina, which is often brought on by exertion, shortness of breath, particularly with activity or when lying down, and syncope, or fainting, especially during or after exercise. Other symptoms may include fatigue, lightheadedness, palpitations, and a heart murmur, which can be heard with a stethoscope. It's important to note that not everyone experiences all of these symptoms, and some people may have atypical presentations. Diagnosing aortic stenosis typically involves a combination of physical examination, patient history, and diagnostic testing. The first step is often a physical examination where a doctor listens to the heart with a stethoscope to detect a characteristic heart murmur associated with aortic stenosis. An echocardiogram, or ultrasound of the heart, is the most commonly used diagnostic test. It allows doctors to visualize the aortic valve, measure the degree of stenosis, and assess the function of the left ventricle. Other tests may include an electrocardiogram, or ECG, to evaluate the heart's electrical activity, a chest X-ray to assess the size and shape of the heart, and a cardiac catheterization, which is an invasive procedure that can directly measure the pressure gradient across the aortic valve and evaluate the coronary arteries. Stress testing may also be utilized to evaluate a patient's symptoms. Aortic stenosis is typically classified based on the severity of the valve narrowing, which is determined by measurements obtained during an echocardiogram. The key parameters used for classification include the aortic valve area, the mean pressure gradient across the valve, and the peak aortic jet velocity. Aortic stenosis is generally categorized as mild, moderate, or severe. Mild stenosis typically has minimal impact on heart function and may not require treatment. Moderate stenosis may cause some symptoms, and close monitoring is warranted. Severe stenosis is defined by a small aortic valve area, a high pressure gradient, and a rapid jet velocity, and it often requires intervention to prevent complications. The treatment and management of aortic stenosis depends on the severity of the stenosis and the presence of symptoms. For mild to moderate stenosis without significant symptoms, regular monitoring with echocardiograms is usually sufficient. Lifestyle modifications, such as a heart-healthy diet and regular exercise, can also be beneficial. For severe aortic stenosis, intervention is usually necessary. The two main treatment options are surgical aortic valve replacement, a SAVR, and transcatheter aortic valve replacement, to VR. SAVR involves open, heart surgery to remove the diseased valve and replace it with a mechanical or biological valve. TAVR is a less invasive procedure where a new valve is inserted through a catheter, typically inserted in the groin or chest, and guided to the heart. The choice between SAVR and TAVR depends on factors such as the patient's age, overall health risk factors, and the anatomy of the aortic valve. Currently, there's no definitive way to completely prevent aortic stenosis. However, certain lifestyle modifications and preventive measures can help reduce the risk of developing or worsening the condition. These include maintaining a healthy lifestyle with a balanced diet, regular exercise, and avoiding smoking. Controlling risk factors for heart disease, such as high blood pressure, high cholesterol, and diabetes, is also crucial. Early detection and treatment of strep throat can help prevent rheumatic fever, which can lead to valve damage. If you have a known congenital heart defect, such as a bicuspid aortic valve, regular check-ups with a cardiologist are essential. The prognosis for aortic stenosis varies depending on the severity of the stenosis and the presence of symptoms. People with mild to moderate stenosis may have a relatively normal life expectancy. However, once severe symptoms develop, the prognosis worsens significantly without intervention. Untreated severe aortic stenosis has a poor prognosis, with a high risk of heart failure, sudden cardiac death, and other complications. Aortic valve replacement, either through SAVR or TAVR, can significantly improve the prognosis and quality of life for patients with severe symptomatic aortic stenosis. Recent research is focusing on improving TAVR techniques, developing more durable and biocompatible prosthetic valves, and identifying genetic markers that may predict the risk of developing aortic stenosis. Additionally, studies are exploring the potential of medical therapies to slow the progression of aortic stenosis in individuals with mild to moderate disease. Thank you for watching. We hope this video provided valuable information about aortic stenosis. Always consult with a healthcare professional for diagnosis and treatment options.